Okay, Naya. Little Miss Naya. Okay, how much? Scale. And this is going to be a big dose. Twice a day. I wonder if there is a snack that you would eat, a wet snack. I would like for us to stay friends after this. What day is it? September 1st. Okay. Okay, everybody. Sorry about all the suspense. So you may or may not be aware that Naya has diarrhea. And so we sent a sample in as soon as, like, it was probably a few days after she got here that we were able to collect the sample and send it to the lab. The lab's been a little bit slow, just a little backed up in the last couple of months. So we only just got results back last night, and we found out that she is positive for toxoplasmosis, and actively infected. She's shedding it in her stool. So that is a parasite that is zoonotic, so it can affect any warm-blooded species. And it is known to cause stillbirth and birth defects in dogs, and there have been we couldn't find any studies. The mods actually found a really great a really helpful article, and Dr. F was waiting to talk to a pathologist because she hasn't encountered this before, and we've had several cats from the Happy Forest that have been infected with toxoplasmosis, but we haven't had any that were actively shedding it in their poop, which means that like they had been infected at some point, but were not actively shedding it, which means that the infection was previous to us testing them. Sorry, so we've had lots of cats with toxo before, and like Hyatt had toxo, which causes blindness. So that part is nothing new, but having it in a pregnant cat, especially in the late stage of pregnancy, is pretty concerning. And we've been sort of scrambling to figure out a plan for like the medication that we normally use to treat them. We didn't know if it was safe, and so we were trying to figure out if we could use it. And so anyway, we are able to use to medicate her for it, and hopefully that will help to reverse any of the damage that may have happened with the kittens and with her, but we just don't know. So luckily we are able to start the treatment, and there is something we can treat her with. Last night I went to bed thinking that we might not be able to treat her, and sort of trying to figure out the risks of treating her with something that isn't safe versus the risks of not treating her when we know she has a parasite that can cause all sorts of damage. So luckily this morning, and also thanks to the mods for finding an article that was really helpful. It does seem like it's reasonably safe to use the meds and treat her, and hopefully we're gonna hope for the best and prepare for everything, just like we always do. But now we're gonna have a nice high risk pregnancy situation again, which we don't love, but we are also, I've asked about whether we need to separate Mavis and Naya. It's transmitted through ingestion of contaminated poop. So they do have their own separate litter boxes, and I'm keeping them clean and swapping them out completely, like every 24 hours. It does take the oocysts, which are the little, it's their vector for infection. It takes them 24 hours to be infective to humans. So I'm just waiting to find out some more about that, because ideally I don't want to stress anyone out by moving them at this stage in pregnancy or kittens. They're both pretty comfortable here, but if it seems like that would be a good idea, then we will definitely do it. And it would be less of a concern for Mavis, because we can treat her, and the kittens are healthy so far, so at least it would be very treatable in them, and we will definitely test them and everything. But first priority is starting treatment on Naya, which means that I have to weigh her and then give her some meds, and it's going to be a big dose of yucky tasting meds, and she's not going to like it. So I think I'm going to get some tuna water, something to help it go down better, which means I need a can opener. So I'll be right back. So, okay, I'm gonna open this tuna and then I'm gonna have to, so she's gonna need this big dose of yucky meds every 12 hours, unfortunately, twice a day. So I see some questions about why wouldn't we do a C-section and would that be the safest thing for her? The labor delivery process isn't what's risky. It's them. It's their development that is risky. So the risk of doing a C-section is high. We only do that as a last resort because we don't know when is the right time to pull the kittens, and so risking pulling them too soon would be just as harmful, maybe more harmful, more risky than letting them go to full term and then just monitoring her delivery closely. So we will do a C-section if she runs into trouble during her delivery. You look suspicious. I apologize for this, but I don't know. Would you step on this scale? Do you think? Is there room for the scale? That would be cool. Then I just have to figure out. This is probably a no-go, but oops, worth a shot. So obviously I'm going to be somewhat anxious until this is over. Hi. I know you don't like me to be in front of you and above you, but if you could just step onto that scale of your own free will, then that's one less thing I have to do to you. I know. Can you do that? Army crawl forward? Or maybe down here? Because I'll get you bit. I know. Oh, I'm sorry. Good. Oh, ferocious. What if I put kibbles on that? Will you go there? So this could be a challenge. Step one was figuring out if we could treat it. Step two will be figuring out how to do it without stressing her out too much. But first, I just need to weigh her. So if I can sort of encourage her onto the scale without having to blanket her, that would be nice. So this is where patience comes in. I'm gonna do your little army crawl over there. You need a trail of kibbles. She's super not into the canned food right now, so. But I will try to mix. I know, I'm being in wings so that you go that way. I'm sorry, I know we were friends. I know. This is not what we talked about. I won't tell anyone your weight if that's what you're worried about. No one's gonna judge you anyway. You have 6 kittens in there. You've been eating for 7. No one's gonna judge you if you've gained a little weight. We hope you've gained a little weight. I know. Okay. If I step out for a sec, will you weigh yourself? If I put some more of these. Okay. Alright, I'm gonna up the ante. You're so lucky because I never give. Good girl. Okay, hopefully the scale doesn't shut itself off. Alright, now. All right. So close, but not really. All right, I'm just trying to think of what is going to be the least stressful way to do this, since we need to do it twice a day for the next 4 weeks. Yep, that's right, 4 weeks. Okay. I'm very sorry about this. Ooh, and it just rained snacks upon me. Alright, let me get this ready. I don't want to do this to you, but I don't think we have a choice. I think you'll forgive me. I'm sorry. I know. I'm also at kind of a height disadvantage here. I bet you can move a lot faster than you look. I'm sorry. Once I weigh you up, but at least we won't have to do this part. For a while anyway. You're so random. Okay. Oh, such a big girl. Okay. .42 with the towel, which I did not weigh first. So that's all right because okay, little pumpkin. Oh, you're a big girl. You're a big girl, Naya. I'm very sorry about all this. Okay, so dose. Oops, sorry. Alright, let's calculate your dose. Okay, so we're going with 10 mg per kg. I think this towel weighs about, I'll confirm the exact weight of the towel, but it's not going to be a big deal if it's off by a tiny bit. But I'm going to go with about 0.3, so we'll say 5.1. And concentration is 25 mg per mil. Oh man, it's such a big dose. I'm sorry. Oh. Let's get comfy because this might take a minute. Oh. Since I have her, I'm going to give her her first dose. Eagle petting. Okay. We'll see how this goes. So 2. It's a big dose and it does not taste good. So, let's see how she does. Hi, I'm so sorry about all of this. Where's your little face? Let me uncover this side because of my right-handedness. I'm hoping that she will forgive me quickly. There we are. I'm gonna give her, this is just tuna water. That's not so bad, right? I'm sorry. And if anyone's just tuning in, she's a feral cat, so covering her face is the only way that I will be able to get meds into her. And even then, it could be a challenge. I will try for her next dose. I'm going to try mixing it with food, and I'm sorry. Doing some other things there. Good job. Thank you for swallowing that. Oh, she's being very good. Oh, I'm so sorry. But this is going to make you feel better, and it's going to help your babies. We're giving your babies a much better chance. And hopefully it'll make you feel better too. You're being such a champ. Let's have a little palate cleanser. One more last little bit. If you go really slow, then you can, oh, I know, that was so much here. Let's have this. Then you can make sure you get it all in. That was just the tuna water. I'm so sorry. What a good girl. Okay, well that's a relief. First dose on board. Look at her little face. Okay, put the lid back on the meds. How much? I think this bottle holds 20 mils in this bottle, so that's 10 doses, so 5 days worth. So I would say 4.5 days worth, given like spillage and all that stuff. So 4.5 days per bottle. And then if I have to experiment to try to get her to eat a dose, I may waste a couple of doses. But if she will eat it on her own, that will be much less stressful for her. Just like how Mavis is taking her Clavox with her food, it's so nice because I don't have to then do this whole thing. Because we obviously want to minimize stress. And it's not like, you can't avoid stress if you're having to towel them. You're so beautiful. So I'm super relieved that we can treat her. But definitely we need to be prepared for any number of issues with the kittens. We should be able to reverse any symptoms in Naya. I remember how I was sort of talking about her peripheral vision and how she might have some vision stuff. That is one of the symptoms of toxo. Or it could just be that she's feral and pregnant, but it is kind of interesting. It can affect their eyes, their brains, livers, basically any organ, lungs, any organ or multiple organs. So what a good girl. What a good girl. So there are a lot of questions. I don't have all the answers. No one has all the answers. There is really not a lot of information out there. Oh, you're a good girl. You're a good girl. So treatment is obviously complicated by the fact that she's pregnant, but luckily it is relatively safe to give her the meds that we're giving her, which is really a huge relief. So because toxo is one of those things that you want to treat as soon as possible, because then you have the greatest chance of being able to reverse any damage. And in order for her to actually be shedding the parasite in her poop, she would have had to have been infected pretty much within the week before she was trapped. So she hasn't been infected that long. What a good girl. We tested both the poops of Mavis and Naya ever since we got the cryptosporidium with Sahara. We decided to start just testing all the poop that comes in from the Happy Forest. So that's why we tested both of the poops in here. But Naya has had diarrhea the whole time. And she has a couple of other things in there too. A couple of other things in the poop too, but not things that we worry about as much. And things that we can treat. What a good girl. So we are waiting on more information before we decide whether to move one of these two out of the room. There's a lot of research that needs to be done, and Dr. F has a very full day at the clinic, and we've all been researching on our own and trying to weigh the risks and the benefits, since they're both comfortable here and it would be stressful to move them. So we just want to understand what the full scenario is before we make any big changes like that. So we will see. So you guys will be learning along with, as we learn. We definitely don't have all the answers, but we're going to work hard to get them. But the good news is that with treatment, the chances for everyone are better. So twice a day right now, we have meds. A giant dose. Oh, that was a big sigh. Thankfully, she seems to be forgiving me for the manhandling and the yucky meds. So I feel better now than I did last night and this morning. But it will be an anxious couple of days till the kittens come. Toxoplasmosis is zoonotic, which means it is contagious to all, in this case, all warm-blooded species, so humans, dogs, other cats. I don't know about birthing spiders, I guess they're not warm-blooded. Hyatt did have toxo, and that's what caused his blindness, because he did not get treatment in a timely fashion. She definitely can see. I was just questioning some of her peripheral vision because she's so reactive to like suddenly seeing things. So I don't know how her vision is. Her pupils are responsive. She has a menace reflex. All the kind of diagnostics you can do from home look all right, but toxo does cause inflammation of the ocular nerve and like we saw with Hyatt had gone blind from toxoplasmosis. So, but we were able to reverse that with the treatment. So in his case, I believe it was 86 days of treatment. 86 long days. Very spicy Hyatt treatment. So once the kittens are born, I haven't had time to read this latest article fully, but it looks like we will have to really monitor them closely for the first couple of weeks. There's not a great way to test like tiny kittens because they don't have enough. I'm assuming they don't have enough blood that we could collect enough to start running antibody titers. I don't even think they would have antibodies at that early. So I'm not sure. I'll have to find out how we will test kittens. Look how pretty she is and being so brave. You're being so brave. feel like she's sort of also just waiting for an opportunity to make a run for it. But she's kind of torn because she's enjoying the petting. So toxoplasmosis reproduces using what's called an oocyst. It's like just a little organism. Oh, I haven't had practice yet. I apologize. She gave me a look. So they reproduce using oocysts, and they are shed through their poop. And then someone else has to ingest some of the infected poop in order to become infected. However, I know that for humans, the oocysts don't become infectious for 24 hours. So I have been swapping out litter boxes daily. And so I think that should keep the risk reduced, but I need to read up about cats, transmission between cats, and if they also need 24 hours. But you can read a lot about it. On the Google. Normally they would get it from like hunting and eating an infected rat or something, or congenitally. So I'm going to say probably a lot of kittens are born at the Happy Forest that where their moms are infected. So who knows? We just don't know. Mavis's poop came back clear, so we will retest that bunch, but at this point she is not infected as far as shedding the oocysts in her poop, which doesn't actually rule out infection. It just means that there weren't any in the sample of poop that we tested. It's all very complicated. It's unlikely that this would have had anything to do with Shanti, because we know Mavis doesn't have it. We're like pretty sure. And Shanti wouldn't have had time to be infected with it. Mavis's poop was PCR negative for toxoplasmosis, which means that no toxo DNA was detected in that sample of poop, which means that she either was not shedding anything at the time or she's not infected. I think I have pretty good protocols and hand hygiene So I'm not that worried about it for me, but you never know. I've been exposed to enough toxo in my days that maybe I already have it. Who knows? Who knows? Yes, so kittens can be infected through the placenta and also through the milk. So that's another reason it's good that we're able to start treatment now. Usually within 24 to 48 hours, we'll see the infection will start to be reduced. So hopefully we'll have a couple days for the meds to work before the kittens are born. My leg's very asleep right now. It has nothing to do with Naya's vocalizing. She just likes to talk. Toxoplasmosis is very common, very prevalent. Pretty she is. And being so good. If I uncover you more, you can make a run for your stairs. But I feel like my laptop's gonna be in the way. Her ear looks tipped, but it's not tipped. She has a wound there that makes it look tipped. She's not purring at the moment, that I can hear anyway. We are going to let kittens nurse because they've already been exposed. And this may change, but the plan at the moment is to let them nurse, and they will get some of the antibiotics through the milk, is my current understanding. Not enough blood to test from the placenta, but that is a good thought. Plus the antibody titer tests take quite a while. Oh, blood flow. They take a couple of weeks to come back, so by the time we got results, it's tough when you can't get results quickly, but we do the best we can with what we have. It would have been nice to get results like a week ago about her poop, because she would be so far into her treatment by now. But it was not to be. You're being so good. there's so many things that if she bolts from my lap are going to go flying, like the full can of tuna and juice and my laptop. I think if I start moving things in front of her, she's going to get nervous. Right? So you guys are this is like the uncensored reality rescue reality part of this, that I don't have the luxury of coming on with all the answers and a solution and knowing it's going to be okay. But I am keeping you all in the loop as I didn't say anything last night because I had literally no answers and did not know if we could treat with anything. And I was trying to be patient and not panic everybody. But you guys will know kind of as this unfolds. Hi. Oh, such good sighing. She's pretty relaxed right now, but she's also kind of alert. Like, I feel like she may decide to bolt. You know how she's a little bit mercurial when she's being petted. Oh, that was a big sigh. You're doing so well. My leg. Wonder how long I have till gangrene sets in. Look, there's a path forward for you to the left there. I would move my laptop, but I think that might spook you. So we're just gonna So my next challenge is going to be to find a way to get her to take her meds with her food so I don't have to towel her twice a day because I don't really want to do that. Oh, hi. No, look, I've been here the whole time. I'm sorry. I know. We're friends. We're friends. You can go. You're free to go. I'm definitely not going to eat you. If I was going to eat you, I would have done it already. Soon this will all be over. Okay. Well, that was your own fault. She tried to squeeze under the scratcher bridge, and obviously it's 3 times wider than the bridge. That bridge, she tried to squeeze under in order to escape, and then that scared her because it went with her because she's too wide for it.
Now I will weigh this towel and make sure that we have the exact right calculation. 0.4. Alright, so that is close enough. So she is about 5 kilograms. So that is the right dose for her. So she's getting 2 meals. And she got her morning one. All right, well, exciting times. Hi, you're being very brave. Oh, look at your little tail. Why are you peeing down the side of the thing? I think she just peed down the side of the nest, possibly, but that's all right. I'm gonna just clean up this stuff a little, put her food up there, and then I'll go so that she can relocate herself back to her ledge of safety and delight. I hear your pee dripping down between the nest and the wall. That's your nest. Now I'm going to have to clean that part. I guess I took your blankets out. I will use this towel. Okay. Let me just make your ledge bed for you. Water. Oh, whoops, that's not your water, that's your kibbles. Kibbles down there. Swishy food. Let's put the secondary water. Are you going to be nervous if I come over here? And can opener. That goes in the fridge. That goes with that. That also goes in the fridge. And garbage. Okay. Scale. You can come with me. Hi. The door is right here. Let's put this here. And let's move this. I hope we learned a valuable lesson about trying to army crawl under the scratcher. There. Let's put your water back. There, we can use that. Okay, I'm gonna go and let you relocate. You've got lots of snacks. Let's put more snacks up there on this end for you. exciting. Never a dull moment here, is there? Are you gonna be nervous if I put snacks over there for you? Okay. Yeah. You like snacks. Okay, now I'm going to go and take this with me. I'll come back and clean up the pee after she's relocated herself so that I don't stress her out anymore than necessary. Alright. Oops, don't leave your phone in the middle of